Okay, hello Professor. This is Devery Sombers, attempting to use Screen-O-Matic for the first time. And this is my week 1 scavenger hunt assignment. Okay, so the first question was asking us to compare and contrast acetaminophen and then the trade. So I went to walgreens.com and I found the cost of acetaminophen was $4.99 and the cost of Tylenol was $14.99. I made sure to get the same dosage and amount of capsules to best compare the price. So 100 capsules at 500 milligrams each for acetaminophen was $4.99, and for 50 pouches of 2 caplets, 500 milligrams each for Tylenol, was $14.99. The ingredients in both of the products, the active ingredient was acetaminophen, 500 milligrams in both. So here was the Tylenol, $14.99, and here was the pain reliever acetaminophen at $4.99. So kind of comparing and contrasting, I learned that the manufacturer of Tylenol is McNeil Consumer Healthcare, and that's a small division of Johnson & Johnson. And then I found this quote: using drugs' trade names rather than their generic names in clinical practice has been shown to increase usage of these brand name drugs over their generic equivalents, even when the pharmacy substitution is available. Tylenol is not different from acetaminophen. Acetaminophen is the generic name, Tylenol is the brand name. The only difference is the inactive ingredients. So that's my first question. For the second question, you asked us to search online for a list of drugs recently off patent. You wanted to know the process of this, what does it mean for the consumers, and then I picked a drug. So to finalize a patent takes about 20 years. Every drug is given a patent that can allow the company to have certain rights to the drug. A patent for a drug can expire at different times, and this depends on the chemicals that are in the drug. Other companies can produce a variation of this drug once the patent has run out on the brand name drug. When other companies produce their own form of the drug, this is known as the generic version. And for us, the consumer, this means that the drug can be cheaper. So from that list, I picked a drug I've never heard of from FDA.gov that had been recently off patent, and I chose the drug Cetrorelix. The approved NDA number is N021197, and the dosage form of this drug is that it is an injectable. So Cetrorelix is a medication used by women having certain fertility treatments or controlled ovarian stimulation. Cetrorelix is used in a combination with other hormones. The drug class is antagonists, and a prescription is required, and it should not be used by pregnant or breastfeeding mothers. The generic name is Cetrorelix, and the brand name is Cetratide. And then I provided a picture to kind of help me see what it looked like. That's what you might pick up from your local pharmacy. So question number 3 is asking me to go to Stedman's and define pharmacology. So I went to Course Point, I went to pharmacology class, and then I went to Stedman's and found the definition of pharmacology: the science concerned with drugs and their sources, appearance, chemistry, actions, and uses. Pharmacology. Okay, the fourth question is asking me to select a drug from that website and then fill out the medication information worksheet. So, okay, the drug I chose was an anticonvulsant called Dilantin. This is the website you provided us. It causes gum hyperplasia. Advise client to visit dentist frequently. So going to my worksheet, Okay, this is my question 4. Okay, so the pharmacological class is hydrotoin derivatives. The therapeutic class is an anticonvulsant. The generic name is fentanyl, and the trade name is Dilantin or Fentech. Other drugs in this same class, I'm going to have a hard time pronouncing these. I'll try. Carbamazepine, oxcarbazepine, and gabapentin. I'm sorry if I butchered those. I couldn't find the common suffix for Dilantin. And when I asked my mother, who's a pharmacist, she said it's kind of in a category of its own, and it doesn't have a suffix. So some adverse effects of this drug can be decreased coordination, and then the client teaching was to educate the patient that if they start noticing decreased coordination, they need to call their doctor right away. Pain can be an adverse side effect, and you need to educate the patient that some pain at the injection site is normal, but if the skin were to turn purple or black, they need to call their doctor right away. Another side effect can be slurred speech. Educate the patient if they start to slur their speech, they need to call their doctor right away. Another side effect of this drug could be constipation. We can educate the patient that constipation is a normal side effect of the drug, but if it doesn't go away after a few days, they should call their doctor. Mental confusion is a big side effect of this drug, and educate the patient if they start to feel confused, they need to call their doctor right away, as well as hypotension is another big side effect. And so educating the patient that if they notice their blood pressure starting to drop, they need to contact the doctor right away if they're able to notice it. So as far as food and drug interactions, I found that enteral tube feedings may interfere with the absorption of the oral drug, and to stop enteral feedings for 2 hours before and 2 hours after drug use, monitor the serum drug level more frequently. So these are some labs I found that may need to be monitored related to this category. I took this straight off the website at allnurses.com. They did a really nice job talking about, all the labs that could be related to this drug. So a couple of pre-administration considerations. You give divided doses with or after meals to decrease adverse GI reactions. For the chewable tablets, patient may chew thoroughly before swallowing or may swallow the whole thing. You want to shake suspension well before use. Administer dose using a calibrated oral dosing syringe. Different oral forms are not interchangeable. Don't crush or allow patient to chew the extended release capsules. For oral suspension, withhold enteral feedings for 1 hour before and 1 hour after giving the drug. So some nurse administration considerations. You want to monitor the cardiac status during and after the IV. Also, Asian patients who test positive for HLA-B1502 have an increased risk of serious skin reactions at the site of IV. If rash appears, stop using the drug. Don't stop drug suddenly. This may worsen seizures. For long-term use may decrease bone mineral density. And use oral when possible. Closely monitor all changes in behavior, and don't confuse them with drugs that may sound alike. And then this drug may stabilize neuronal membranes and limit seizure activity, either by increasing efflux or decreasing influx of sodium ions across cell membranes in the motor cortex during generation of nerve impulses. Okay, so that was question number 4. Question number 5 was very similar, looking at the COVID-19 vaccine. So I got my information from the cdc.gov. So I did the Moderna vaccine, mRNA 1273 vaccine. It's a vaccine. Moderna doesn't have a trade name. Another drug in this class is Pfizer Biotech. So some adverse effects. And all these adverse effects I did, they're common side effects. So pain, headache, fever, tiredness, redness at the injection site are the side effects I did. With pain, teaching the patient that it's normal. Exercise your arm. It may limit your ability to do your daily activities, but should go away in a few days. Headache, another normal symptom. Drink plenty of fluids, dress lightly, and then if it doesn't subside in a few days, call your doctor. Fever is another common one. If you have it for more than a few days, you should call your doctor, but drink lots of fluids, keep cool, get lots of rest. Same for tiredness. Get rest, lots of fluids. The fatigue's a common symptom, should go away soon. As well as redness at the injection site. Educate the patient, it's a common side effect. If the redness doesn't go away, they should call their doctor. They could also apply a clean, cool, wet washcloth over the area to try to reduce some of the redness. So I didn't find any harmful food interactions that go along with receiving the vaccine. According to the CDC, there are no specific lab tests that can definitively diagnose the cause of severe allergic reaction, the anaphylaxis, after the COVID-19 vaccine. Some pre-administration considerations are that there are 2 shots in this vaccine. They should be taken about 28 days apart from one another, so to plan accordingly. The vaccine is not recommended for people under the age of 18, and not to get the vaccine if you're allergic to any of the ingredients in the vaccine. Some nursing administration considerations is to educate the patient on possible side effects, educate the patient on the number of days in between the 2 shots, educate the patient on how to report their signs and symptoms, if they have any adverse symptoms, and educating them on the effectiveness of the vaccine. So the overall evaluation of medication effectiveness. All of the COVID vaccines are effective in preventing COVID as seen in the clinical trials. The COVID vaccine helps protect people from getting sick with COVID and might help people around them. Must get the full recommended dose for the maximum effectiveness. You can't just get 1 shot. And the vaccine is not 100% effective. The Moderna one, they say, is about 94.1% effective. So making sure that they know that. Okay, the final question on the scavenger hunt asked me to create my own quiz on PrepU, 5 questions for chapter 2, and then to look at the results in the book, find the page, highlight, and then add it in the notes. Okay, so here is the 5-question quiz I took. So I chose number 3 as the one I used. So the recommended dose of a drug is based on drug evaluation studies and targeted to which population? I chose it's 150 pound person, which I got correct. And then it's telling me that I can find the answer to this in the book, chapter 2, page 26. I went to chapter 2, page 26. The recommended dose of a drug is based on drug evaluation studies and is targeted at a 150-pound person. So I highlighted that, and then I added it in the notes of the PrepU. I just copied and pasted what it said. I added the page number so I can know. And I can do that for every question if I'd like to add a note. If I were to get it incorrectly, maybe add a note to help myself remember it. And that was the last question on the the scavenger hunt. Overall, I really enjoyed this assignment. I feel a lot more confident on each of the resources that are provided to me, whether it's Stedman's, anything on Course Point, how to make a prep U, not just for an assignment, how to use it as a study tool. All the different drugs I was able to look up and all the information. I'm feeling a lot more confident with the use of these resources provided to me. So thank you.